This is the first part of the voice-over PowerPoints for Unit 3, covering pregnancy. This is in chapters 8, 9, 10, 11, and 12 in your book. Objective 21 is the conception of an implantation, and this is carried over from the previous unit. Conception, again, is the union of a single egg and sperm, and it marks the beginning of pregnancy. Mitosis is body cell division. It is the repair of your normal body cells. Meiosis is sex cell division, or the formation of the egg and sperm. Gametogenesis is the process of actual egg and sperm formation. This figure is very similar to the one in your book in chapter 8. Figure 8.5, you can see during spermatogenesis there are 4 sperm that are matured and able to fertilize the egg. In oogenesis there is the formation of 1 egg. This is a sperm. You can see the acrosome, which contains enzymes to help penetrate the ovum, the midpiece, which contains mitochondria for energy, and the tail, which allows for movement. Fertilization typically occurs in the outer third of the fallopian tube. You can see that in figure 8.8 in your book. A zygote is formed within the union of the sperm and the ovum. As soon as the sperm penetrates through the outer core of the egg, it reaches the inner portion of the egg. There's a chemical change that occurs in the cellular membrane of the egg, which allows no other sperm to penetrate. Through cleavage, which is cellular division, a morula develops, and a morula is just a solid ball of cells. The morula further divides into a blastocyst, and the blastocyst has 2 pieces, the trophoblast, which becomes the chorion and the placenta, and the embryoblast, which will eventually become the embryo. Implantation occurs when the trophoblast secretes enzymes, which allows it to embed in the endometrium. Pregnancy itself is 10 lunar months or 9 calendar months, 40 weeks or 280 days. It is calculated by gestational age, which means it's calculated from the first day of the last known menstrual period of the individual, or it is calculated by fertilization age, and this is calculated from the time of conception. Many women actually do not know when conception occurred, so most times we use gestational age because most women do know the first day of their last known menstrual period. Fertilization age is commonly used when discussing embryonic and fetal development. So it's important to know the difference between gestational age and fertilization age. Gestational age is always 2 weeks more than fertilization age. There are 3 stages of intrauterine development. The pre-embryonic stage, this occurs from conception to about 2 weeks post-conception. If mom takes any teratogenic substances, it has an all or none effect during this time. And that's because there's really no communication between mom and the developing embryo. The embryo is just kind of floating around in the fallopian tube and into the uterus, and there's really no connection. So she may take like a hit of crack cocaine, and it probably won't have any effect on the baby because there is no communication between her and the baby. Embryonic stage of development is from about 3 weeks post-conception to 8 weeks post-conception. This is the most critical time in the development of the organ systems called organogenesis, and teratogens have the greatest effect on the developing systems during this time. If mom does hits of crack cocaine during this time, it is common that the fetus will have some sort of anomaly or long-term effects from that. In the fetal stage, it's from 9 weeks to 40 weeks. There's further refinement of the major organ systems, but they are all there. The brain and the nervous system remain susceptible throughout the entire intrauterine development to drugs and teratogens. This is table 3-2. It's just a couple of agents and that are teratogens with their effect on the baby. Again, you can see that alcohol can cause fetal alcohol syndrome, which can lead to low birth weight, microcephaly, mental restriction, unusual facial features, and cardiac defects. ACE inhibitors, which are common blood pressure medications, can cause renal tube dysplasia and intrauterine growth restriction. Cocaine can cause cerebral infarcts in the brain of the developing fetus and placental abnormalities or abruption. Herpes can cause blindness or cataracts. Toxoplasmosis can cause fetal demise, blindness, or mental retardation. When the embryo is beginning to develop, it develops from germ layers. In germ layers, there's three primary germ layers: the ectoderm, which I think is the outer layer, and what develops from that is the epidermis, the glands, the hair, the nails, the nervous system, lens, cornea, and internal ear. The mesoderm, which is the middle layer, creates the dermis, the bone, the cartilage, the muscles, the cardiovascular system, the spleen, and the urogenital system. The endoderm, which is the inner line, which is the lower layer of the developing embryo, forms the linings of the respiratory and digestive tract, the mucosa of the GI tract, the liver, the thyroid, and the pancreas.